Hello everybody, myself Dr. Amol Akhade. I am medical and precision oncologist from Fortis Hospital Mumbai. Today I'm going to talk about a very important topic, breast cancer and its treatment. So you must have heard that the incidence of breast cancer is rising and there are various treatment options that are coming up. So the question must have come to your mind that how doctors decide about the treatment of breast cancer. So let me tell you, not all breast cancer are same. There are 4 distinct types of breast cancers. One, which is ER/PR positive HER2 negative. Second, ER/PR negative HER2 positive. Third, triple positive. That means all 3 markers are positive. And the fourth, triple negative. All 3 markers are negative. So you may ask, what is ER/PR and HER2? So it is the markers that are tested on the tissue sample. ER stands for estrogen receptor, PR stands for progesterone receptors, and HER2 is human epidermal receptors. These markers decide the aggressiveness of the tumor. So these are the important factors that the doctors see when they plan the treatment. The other important factors being size of the tumor, the number of lymph nodes present, and of course, associated comorbidities of the patient, age of the patient, whether the patient is premenopausal or postmenopausal, whether the patient has associated diabetes, hypertension, or heart problem. So basically, the treatment is accumulation of the tumor factors, the patient factors, and of course, the genomic factors that are tested by the doctor. So what are the genomic factors? We generally, in a precision oncology clinic, test for genetical risk factors like BRCA1, BRCA2 mutation and associated other genetical risk factors by doing certain tests called as either Oncotype DX or the Indian versions of these tests to understand the genomic risk profile of particular tumor in that particular patient. Based upon that, we decide whether the patient requires chemotherapy, patient requires chemotherapy in addition to hormonal therapy, or patients require targeted therapy, or patients may require immunotherapy. Of course, most of the early stage breast cancers require surgery as well as radiation therapy. So it is necessary to understand that the breast cancer treatment has evolved over last 2 decades to such an extent that now it is a multimodality treatment in which surgery, chemotherapy, hormonal therapy, targeted therapy, immunotherapy, and radiation therapy are all part and parcel of the treatment. It does not mean that every patient requires everything. The expert oncologist will decide what is exactly required for your patient based upon the tumor characteristics, the genomic characteristics, and of course the patient's overall health and comorbidities. So do not get worried if you get breast cancer. The chances of cure are very high in early stage breast cancer, as high as 80 to 90% of early stage breast cancer gets cured. Or in advanced breast cancer also, there are so many treatment options available that the life can be prolonged with good quality of life. And good point is that now we have a lot of oral drug options also, especially newer drugs like CDK inhibitors and newer hormonal therapies, which are oral formulations, are available. And hence, we have various good options available where the patients can get good quality of life in spite of having an advanced breast cancer. So once again, let me tell you that the breast cancer treatment is not one for all, but it is tailor-made for every particular patient, and you must consult a team of precision oncologists for them to help you plan the treatment of your breast cancer patient. Thank you.